One of the things we did as a hospital early on was work with our medical staff partners to really simplify the quality equation, if you will. There are so many metrics that all hospitals look at related to quality. We said it all boils down to risk-adjusted mortality. We will continue to focus on all of those other metrics, but the one metric that we can look at to see ultimately how we're doing is really the risk-adjusted mortality. We're always wanting to know how we're doing. We measure as real time as we can. We know what our mortality index is as quickly as it comes out from UHC. We share our data pretty widely so that everyone sees that data, both the good and the bad. If we have an area that we're not performing as well as we'd like to, we get the team around the table and say, what are we going to do about this? It's really about that collaborative approach that we have. When you see any major initiative around quality, you will see medical staff members working with hospital members from across the organization, whether it's the nurse or it's the pharmacist or it's the respiratory therapist. They will work collaboratively with the physician to really help address those quality metrics in our hospital. Because from a patient's perspective, they see dozens of people, sometimes hundreds of people, and it takes every one of them to really achieve the outcomes that we're looking for in that patient experience. It's everyone from making sure the environmental service worker is doing their job and keeping the environment clean, to the unbelievable expertise of the physicians, to the care that's provided every day by the nursing staff, to the pharmacist who is providing expertise and knowledge on the med delivery. So it really takes the entire team. There's not one person in our hospital who doesn't have an ability to contribute to our organization. We clearly feel honored to have received the recognition that we have on a national basis, whether it's the U.S. News and World Report, 6 areas being focused in the top 50 hospitals. That's remarkable. But I don't think it's just about the recognition. I think the fact that our outcomes have been so good, that has really led to our ability to make those top 50 lists. If you really peel it away, it still goes back to outcomes, and it always goes back to the patient.